Okay, once again, good evening, everyone. My name is Kazim. I'm the academic secretary for the Sudanese Doctors Union in Ireland. Um, Welcome you all to the marathon, to our yearly marathon. So, uh, today's session, today's session is going to be about first job survival tips and also how to tackle stress. We have two speakers who are very keen and helping us give this talk. Number one, they've been through most of the hassle, and number two, they are very eager to share it. We have Lena. She's a surgical SHO core surgical trainee in plastic surgery and reconstructive surgery. She'll tell us all about herself in shortly. And we also have Musab Eltayeb. Musab is a cardiology registrar in the CUH in Cork. Um, Now, Lena, can you hear me?
Yep,
Brilliant. So, I'm assuming you have a few slides to share, don't you?
yep, I can
And
test that out there.
are you able to share from your end?
So I just sent a request there for sharing. Hopefully,
Yeah, approved.
perfect.
So if you wouldn't mind by the time you're sharing, if you're just tell us about yourself as well,
Yes,
so everyone
so
would know.
can everyone see that actually? I think that worked a bit quicker than I
Yep.
expected. Perfect. Let's just go full screen there. Perfect. So, Assalamu alaikum, everyone. I'm Lena Dablouk. As you mentioned earlier, I'm currently a core surgical trainee working in plastic and reconstructive surgery in Cork University Hospital. So, it's a pleasure to speak to you all this evening. I'm going to kind of give a whistle stop tour of some tips and tricks for surviving your first job in Ireland, and also some tips for trying to avoid more so burnout and stress as
Yes,
well,
as well.
knowing when to recognize those signs. So I'll just move this. There we go. Perfect. So, as I mentioned, I'll be offering some practical tips for navigating the Irish healthcare system, listing off some useful resources, some things that other people recommended to me, starting off as an intern last year and I'm still using now. So, hopefully, everyone can have access to those as well to use as they're adjusting to the new healthcare system. So, obviously, starting a new job, it can be stressful. There's a steep learning curve. It's a new system, new hospital, new colleagues. So that's always going to bring with it a bit of stress. But I think there's different kind of tactics you can have to help you manage that and to get used to it all. It doesn't help as well that there's some high expectations from people working that you're working with. So that's going to maybe can contribute to some of that stress. But it's important to kind of be patient with yourself and give yourself time to adapt to the new environment. So, settling into Ireland, especially if you're coming here from Sudan for the first time or any other Arabic country, there is a big cultural adjustment. It's going to take some time to adapt to the communication style within the hospital, between patients, between colleagues. Probably the most difficult thing is going to be understanding the accents and the different slang that's used here. I still struggle with it myself sometimes from some of the patients, and I've been here my whole life, so it's not rude to ask someone to repeat themselves or to just clarify what they said. That's better than trying to guess what they said. So that's another thing that will just come with time. The weather here obviously is one of the main differences, and we're starting to go into the colder seasons now. It's getting gloomy and rainy, and obviously that doesn't help with your own mental health and all of that. So it's just another thing to adapt to once you're settling into the country. So it's important to try and build connections within the hospital. You're going to be kind of spending most of your days working, so it's important to kind of have good connections within the hospital, but also making time for life outside of the hospital and trying to have a reasonable enough work-life balance. So these are just some resources that I used. So I mentioned I was an intern last year, so it was kind of new to medicine in general. So these are the different apps that I collected just throughout the year. People recommended them to me. I still have them on my phone and I reference them from time to time. So if you want to maybe just take a photo of this or a screenshot and download some of these apps to your phone, I think they'll be of huge benefit to you as you're starting to work in hospitals. So the NCHD, DIT. So some of these are CUH or Cork specific, but you can kind of change your location to whatever hospital you're working in. And even if you can't change it, there are kind of guidelines and algorithms that are applicable to whatever hospital you're working in. So the NCHD guide and the EMED, they're CUH specific, but they have really good algorithms for when you're on call or different emergency scenarios. And it's just a nice quick reference guide to have. MD Calc then is really useful for formulas. It just kind of has all the different formulas laid out for you in one place. It saves you time having to calculate it yourself. So if you're trying to calculate maybe a Wells score, or CHAS-VAS, Glasgow, Blatchford, whatever it is, it's all in one place. It takes a couple of seconds and it just saves you time. OLIS is really good for, it's probably one that I use the most. It has really good antibiotic prescribing and just medication prescribing guidelines. Medicines Complete and Stockley's is similar. Stockley's is good for checking any drug-drug interactions. So if you're just kind of worried about putting a certain drug on the Cardex, just quick search on Stockley's, put a list of the medications and just double check to make sure there's no interactions. BMJ Best Practice is great for just having all your topics in one place, handy one to have on the phone as well. CliniB is good for pediatric doses. So if you're not working in pediatrics and you have to prescribe something for a kid, obviously the doses are different. It's all weight based, so it's kind of a nice place to reference to know for prescribing for kids. So highly recommend CliniB as well. Up to date, another useful one for medications. Lab guide is hospital specific, but I'm pretty sure most hospitals would have one. Just knowing which it's good for taking bloods. If you're not taking bloods regularly, if you're on call, just has a list of what goes into what bottle. It's kind of different between different hospitals. So if you're moving around a lot, you're bound to get kind of mixed up between the different ones. So it's just another handy one to have. And then Hospital Buddy and Microguide, I don't use them as much, but they were just recommended by other people. So I've listed them there in case anyone else would find them useful. So that's really handy. It's handy just to have those on your phone. Saves you having to go to a computer, look in a book, look things up. It's just everyone carries their phone with them, so it's nice to have it all in one place. Another tip then is it's important to stay organized, be punctual, bring your essential items to work with you. It's going to save you time down the line. Save important phone numbers. So what I mean by that is you'll kind of notice that when it comes to making referrals or contacting different departments, you might find that you're trying a few different numbers before you find the one that actually works. So once you find the one that is the actual one to use, save that to your phone, save the hospital you're working with next to it as well, just in case you're moving around a lot. And that's going to save you time then down the line. If you have to make that referral again, you can just, you know exactly who to call. And even if you're moving hospitals, you'll know which hospital that number is linked to. So that's just another tip that I found. I started doing that last year as well, and it just saved me time down the line. Make a to-do list and update it as you go. That just kind of helps you stay organized and stay on top of things and know what you have to do for the day, and just tick things off as you do them. It's kind of a little boost for yourself as well when you see yourself working through a to-do list. Prioritize and group tasks. So know what's the most important, start with that sickest patient first, and kind of get things done by location. It saves you having to run to different departments in the hospital. If you have a few people to see on one ward, see them all at once. If you have people in ED, just see them all when you're down there. It just saves you having to go back and forth. And lastly, ask for help. You don't have to try and be the hero. If something's outside of your scope, ask someone else, get a second opinion. You try and be a good team player and just ask other people for help whenever you need it. So just communication is probably one of the most important factors when it comes to trying to work efficiently yourself and within a team. Make sure you go to handover. Most teams have it every morning, and then at the end of the day as well to make sure just handover in the morning just to make sure you know what you're meant to do for the day. And then at the end of the day, it's just to double check everyone got everything done. And if not, you know what carries over into the next day. It just makes for a good workflow within your team. Write good, clear, structured notes into patients' charts. So just on the ward in the morning, document everything really clearly from the get-go. That's going to save you time down the line. It's going to prevent kind of getting phone calls from different wards, from the nurses asking for treatment plans for patients. So if you just have it all structured really nicely in the chart, they know everyone knows what the plan for the patient is for the day, and that's going to just prevent interruptions as the day goes on. Similarly to that, then it's important to kind of try and foster a good relationship with nurses and MDT staff. There's a big push for MDT within Irish hospitals, so it's important to try and make sure that you have a good relationship with the nurses, occupational therapists, speech and language, dietitians. So that's just going to help then make sure that the patients all get the care that they need. Lastly, escalate early, don't delay. Don't try. I mentioned earlier, if you think that you need input from different teams, ask the different specialists. People specialize for a reason, so go to the experts, get the help. Don't try and solve it all yourself. So, second part, then stress. So, a few tips for trying to avoid it. I think in healthcare and working in a hospital, it's kind of impossible to not be stressed. That's why I said in moderation, it's important to kind of recognize when is it starting to slowly tip into potential burnout or too much stress. Everyone deals with it differently, but I think you'll kind of recognize your own warning signs for potentially becoming burnt out. Maybe you might become a little bit more fatigued, irritable, your concentration levels are low. So it's important to recognize that early and to try and talk to someone, try and get help for that. At the end of the day, you can't really treat people if if your own well-being is compromised. So it's kind of important to try and make sure that you're working to your best ability, and not having any negative impacts on patient safety. And then the last point here is just knowing when to say no. So obviously, if someone senior gives you a job, you're not going to say no. But this is more so in terms of taking on too many, maybe extracurriculars. If a lot of people are asking you to help with their research projects or something like that, just kind of know your own limit. Don't take on too much. That's going to potentially lead to burnout down the line. So just core strategies for managing stress. I think most people can probably list this out themselves, but I'll just repeat them here. Having good, strong foundations, get your 6 to 9 hours of sleep, whatever it is that you're used to, good diet, exercise. That's just going to help make sure that you're fit and able to do your work properly. Good time management is key, minimize distractions, use your annual leave. So everyone's entitled to annual leave. You can check your contract for the specific days that everyone gets. I'm pretty sure, I think it's different maybe for different levels, but maybe it's six days of annual leave every 3 months, but apply for it. Everyone should be able to get their annual leave. If you're finding difficulties, you can always escalate that. It's in your contract, you're entitled to it. Apply for it early and make sure that you have your designated days off. Make sure you use your study leave as well. Don't use your annual leave for exams or going to courses or conferences. They're two separate things to apply for, and you get lots of study leave as well for every rotation. So look into that. Make sure that you're applying for the appropriate leave, and not using up your annual leave days for conferences or anything like that. And try and find some coping strategies. Everyone's going to have different hobbies. So just make sure you make time for that. Traveling, meeting up with your friends, time for your family. So it's important to try and have a good work-life balance and avoid being too sucked into just working and staying in the hospital the whole time. Another potential source of stress is financial stress, obviously. So a lot of people don't know about the different financial supports that are out there that the HSE provides. So I've listed them out here. There's different categories, but it's all on the HSE, your NER website. It lists it out really clearly. Everyone's entitled to TSS, that's the training support scheme. It's different depending on your tier or what level of training you're at. But everyone can apply for, so interns will get 1,250, SHOs and regs get 1,750, and then specialist regs, GP regs, or psych regs get 2,500. So these go back to zero at the end of every year if you don't use it. So it doesn't carry over into the next year. So if you don't use it, you just lose out on the money. So look for a course, look for a conference, and just use your TSS for it. Even if it's something that's not in Ireland, you can get reimbursed for accommodation or for flights. So it's a really handy resource to know about. And it's really easy to apply for. You just fill out a form online. You just need a document that shows proof of purchase to apply to link in with your application. The medical manpower then looks through it, and you should be able to get your money back for any of those. Similarly enough, there is a clinical course and exam refund scheme. I'm not too sure of the amount for this, but they list out a bunch of courses and exams that you can get your money back, and a lot of them are exams or courses that are required for training. So make sure that you use that as well and apply for it. It's similar enough process. You just need proof of purchase and submit it to the website, and that doesn't take too long to get back either. And then lastly, this is another one that I didn't know about until recently. There's a relocation expenses scheme as well. So especially with if you're on a training scheme, you move around a lot. You're going to different hospitals. You're going to different counties. So you're entitled to €1,000 of relocation expenses. Obviously, that's not going to cover that much of what it costs to move, but it's better than nothing. And it's similar enough. You just need a signature and a form, and you submit it, and you should get that back with no problem. So I think they're really useful resources to be aware of, and to know about them early on, and you can kind of plan your courses and different conferences accordingly then based on that. Another thing then, I think they touched on this in the last webinar, the HSE, they're big on mental health, well-being, avoiding, preventing burnout. So there's loads of different services and supports on the website. I did a quick search the other day just to kind of list them all out and have them all in one place for you. So there's the Employee Assistance Program that offers counselling services for HSE doctors, and it's all confidential. Occupational health service as well. Know where your different occupational health services are. Usually there's an induction at the beginning of the new kind of starting in July, and they list all the different contacts. So if you didn't attend that, you can link in with your own medical manpower and just get different contact details for the different departments. There's an NCHD hub online, which is really good actually. It has kind of everything listed out in one place, different links, and it gives advice to non-consultant hospital doctors as well. The IMO is a great organization actually, and they offer support to healthcare workers, and they're big into this is actually one of their campaigns, and I have a link for the different kind of agreements that came about from this, and I have a list of them here as well. They've kind of tried to make sure that different departments are sticking to the rostering rules in terms of the amount of hours that you can work in a week. It's not really realistic for some specialties that require you to kind of do a lot of overtime, but it's just another thing to be aware of. They've introduced if you work a certain amount of days in a row, you're entitled to extra days of annual leave. And if you can't get those annual leave days, you're entitled to getting a certain amount of days pay. So this is all kind of stuff that's in the fine print that not many people know about. So have a look at their website, go through your timesheets, see if you can potentially apply for extra days off or extra the pay that you're entitled to. So I'd recommend having a look at their website. They have it all really clearly laid out. And then lastly, MPS is great for just having a backup for any medical legal issues. Obviously, they come with a lot of stress themselves. So they're kind of an organization that's dedicated to supporting healthcare workers for anything like that. So just some final tips. Link in with your colleagues. You're going to be working with these people for the next 3 months, 6 months, or a year, depending on your rotation. So try and build a good rapport with your different team members and know when to ask them for help. Link in with the SDUI. I heard about them last year through the conference, and I think it's a really, really great platform and organization, and just kind of nice to have a community for the Sudanese doctors in Ireland. Just kind of feels like a bit of home. So it's nice to have people to link in with. They organize really good events. They have really good workshops for academic. They help you with statistics and abstract writing, stuff that's really important for your own portfolio and CV. So highly recommend linking in with the SDUI and going to different events, meeting different people. Find good mentors and supervisors within your hospital. That's going to help when it comes to kind of progressing within your career. Know who to ask for advice. Find good supervisors. They can help you with references, with research, and that's all going to be really useful for your CV down the line as well. register with a GP. That's just another point. Make sure that you have your own doctor in case you're ever sick. Have a source and someone to go to that can link you in with trying to get follow up or anything like that. So it's really important for doctors to have their own GPs as well. Make time for family and friends. I mentioned that earlier. It's not just about work. Life outside of work is important as well. Stay organized. Just keep up to date with everything. It's going to help you kind of keep on top of things and prevent you going into the burnout side of stress that I mentioned earlier. And last tip is just look after yourself, not just your patients. It's all good. It's going to help you down the line as well. So kind of don't get too sucked into the work, the long hours. There's a lot of demand obviously that comes with working in healthcare, and trying to build up a CV and all of that. But just kind of make time for yourself to kind of sit back as well. So that's another important point, I think. So that's the end of my presentation. Happy to take any questions now or maybe at the end after Musab speaks as well. So thanks very much.
Thank you very much, Lena. That was an amazing presentation, to be honest. You've enlightened most of our colleagues here as to what they can avoid and what they can do, all the little tips and tricks. And to be honest with you, looking after yourself, your last tip is very important. A lot of us get sucked into the day-to-day job. By the time you get home, you're wrecked, and all you want to do is get some sleep, and you actually forget to look after yourself by even a small hobby or something that you like to do. Okay, I think what we'll do is maybe we can put all the questions in the comments. In the meanwhile, I think we'll move on to Musab, and then we can answer all the questions in the end, if that's okay.
Perfect. Yep.
Brilliant. Musab, can you hear me?
Hi, Qasim. Yes, I can. Thank you.
Welcome on board, Musab. Are you able to share your screen?
Hopefully I am. Yeah.
Excellent. Floor is yours.
Perfect. Hi, everyone. Thank you for having me today, Qasim, in this marathon, and I hope all the best for the rest of the marathon. First of all, I'm sorry, I just had here the recent bereavement with my grandmother, so I might not be as good as expected. And thank you, Lena, for your presentation. That actually was really good. I labeled my presentation today as it's not just about surviving, it's about thriving as well. And I'm going to take you into a journey. Lena kindly laid out the basic for it, coming to Ireland and working in Ireland. But I will take you a step back and start from Sudan, actually, because most of people who and I assume that most of people who are here today are probably either coming from Sudan or from wherever they are, but they are not in Ireland based. It's going to be a little bit different than what Lena said, in the context that I'm going to start from the beginning. It's going to be a brief introduction. I am Musab Eltayeb. I'm a cardiology registrar in Cork University Hospital, and I have been in Ireland. This is my fourth year. I kind of divided the presentation into before arriving, after arriving, and before starting a job, and the first days in the job, and then smoothing in kind of thing. We have gone through the introduction. Finding a suitable job, I think, is the best beginning. So it's even if you want to thrive your first job, you really need to look into the most suitable job. And when I say suitable job, you kind of need to know yourself, as in what's your capabilities and what's your limitations. Because if you didn't know this is going to, you are going to face a lot of problem and struggles, in particular the limitation. So because you're probably applying to either an SHO post or a reg post, but that's all depending on their capabilities. And there's big difference between the system here in Sudan. And even if you're coming from Gulf Arabian country, I think there's big difference. There's loads of our colleagues here who came from Sudan or Gulf Arabian countries, well renowned in their countries, but they have struggled a lot, especially with coping with the difference. There's huge difference in terms of the system, the paperwork, the amount of paperwork is completely different. So you need to know what you can do and what you can do, and you need to apply for the job that you think is suitable for yourself. And if you're, for example, is line is surgery, I would advise to stick into applying for surgery, especially if you are looking into higher level post, as in reg post. But if you're starting as an SHO or you have been practicing as a GP, that wouldn't be a problem. You can apply into an SHO post into different departments, I would say. But for people who have experiences in certain areas, I would say they need to stick to their areas. They have better chances applying for those jobs, and also they have better chances thriving in these jobs. So this is the first thing. You'll be faced by a lot of challenges, and you need to know also what kind of challenges that I'm going to try to lay out, at least from what I have experienced when I started here in 2022. So finding a suitable job is the first step um, into thriving in the first job. So the suitable job might not be your dream job. You might want to be, for example, a neurosurgical consultant and down the line, but this might not be, the area to start with. There's only two neurosurgical centres in Ireland, Beaumont and Cork, and so it might be a bit difficult to go straight into the neurosurgery field, for example. So a dream job might not be the suitable job for you. You can start on different department and maybe try to get into the field that you're looking for. So finding the right job is always the answer. The next thing that I find also haunting a lot is the job prerequisites. Once you have kind of got the job that you think it's the most suitable job for yourself, you will be haunted by the amount of paperwork that you need to do from the mandatory courses, and also into the amount of emails that you have to respond to. And you might find yourself also overwhelmed with the amount of things that you have to do. These loads of things that you need to do, the visa requirement, the paperwork, the mandatory courses, and all your paperwork as you are getting ready to leave your country or the country that you have settled in for a few years now, looking into your future. And my advice is always to look to plan for 5, even 7 and 10 years in order to know what kind of papers you need to get ready. I have seen people who have spent 5 years in Ireland and now they're stuck because they forgot to bring one of their main documents with them, or forgot to even to get it ready by the time when they before they came to Ireland. So try always to plan for 5, 7 years and know what you want to do in order to get ready for what's coming in. I'm sharing now the amount of emails that I have back and forth replied to the manpower in my first job. I have counted them. They are probably more than 30 in a span of 2 months from the time I got my job till the time I arrived to Ireland. So the second thing, and also it's before coming to Ireland, is the visa application. the visa application can be a bit haunting. So you just need to look into someone who has gone through the process before you, someone who just arrived to Ireland, because the requirement for the visa itself is different from country to country, and also these changes always happening in terms of the application process. So, for example, from Sudan, it was paperwork. You just go to the consulate. It was in Dal, I think, and you bring the papers, which I think is probably the contract, along with your probably your work permit, along with the bank statement, and a fees that was around 50,000 Sudanese pound. So obviously now this option has gone. So most people are applying from Egypt, and they have faced a lot of hurdles to apply from Egypt. So if you contacted the embassy in UAE, they would give you clear guidance about what exactly to have when you go to your appointment in Egypt, and they can try to also facilitate things for you. So this is kind of the layout of Ireland, divided into the region, um, where I'm right now in the Monster area. So it's good to know where are you going to, and where you're going to live, at least for the next 6 months or a year. And it's good to know also from the perspective that, as Lena said earlier, there's different slangs, different accents in Ireland, and I found it actually quite difficult to cope, moving from a region to region and trying to understand people different accent as well. So these are tips before we move on. Always know your area you are going to in advance. And by the area, I mean the town or the city you are going to live in, and try to find exactly where is where, for example, your Sudanese community gather, or for example, the most important restaurant. And also, some people might find it difficult, and they struggle in the first days to find halal food, in particular. I'd say you have to kind of know your area in advance, the area you are going to. Also, try to know the hospital in and out. That's even before starting your job. It's good to know the area and the hospital, sorry, in and out, in order to know where you are going to, and how you can actually navigate the place, or the hospital in particular. Also, try to engage with the Sudanese community beforehand. Most of the Sudanese community in different cities has a WhatsApp group, I would say. And if you can get into that WhatsApp group, it will be easier for you. They can facilitate so many things. For example, joining the Sudanese WhatsApp group in my first city, which was Limerick, has facilitated me the accommodation, which is a huge struggle here in Ireland. So that's pretty handy to try to engage with the community beforehand. And as Lena said, you can try also to contact the SDUI members there, if you know any of them. They probably are, have stayed there for long enough to know the area around and to try to facilitate things for you. They are the most helpful people, I'd say. So this is one of the biggest tips I would say I can give you, is to try to sort your accommodation before arriving, especially if you have a family that you are bringing with you. You are going to struggle a lot and spend a lot if you don't have an accommodation I've seen people spending thousands and thousands in their accommodation because they haven't sorted that before arriving. So if you can sort your accommodation before coming in, that will be very good, and it's going to ease in your life, because you're not going to worry about the accommodation while you are trying to get used to a lot of other things and try to get your paperwork done. Because the paperwork is not just before starting the job, it's also when you arrive. There's loads of things that you need to do that I will try to go through in this presentation. So this is just to give you an idea about the housing crisis in Ireland. This is a queue for people who want to view one apartment. So it can be really bad in certain places, in particular Dublin and Cork and Galway maybe. There's other places maybe in moderation the accommodation are available, but still Ireland overall you will struggle in finding your accommodation. That's our lovely airport that has been destroyed now, I'd say. So this is just before you go from wherever you are going from, as in country. So um, arriving in Ireland is the next step after, trying to get yourself the things before starting or before coming to Ireland. Um, and I would like you to listen to this. This is listen to Mikey.
Gardaí in County Kerry are investigating the theft of up to 60 sheep on Mount Brandon. One of the farmers is offering a reward for information leading to the return of the ewes, which are worth how. Last Saturday, Mikey Joe O'Shea brought his flock of Scotch sheep down from the mountain, going for a number of deaths and I said before Monday about night until it should be bright out and I could anyone go up in the mountains about night, sure. Well, there was 45 sheep missing, like in the lambs and everything. The sheep just count out the night between money, like.
So this is just to give you an idea about, the accent in Ireland. It can be quite difficult to understand. This is a man from Kerry. I still struggle with them coming to the A&E with their accent. So it can be very tricky. So it's very easy for sometimes getting used to certain accents, but you might struggle still, even if you're in Ireland for a few years, with some accents. So try to listen to the radio, because it's going to make your, better used to the accent. Even if your English is actually quite good, you will still struggle with certain areas and certain accents, certain slang as well. Few difficulties that I have also find beside the language is the weather, especially if you're starting, in the January intake. The weather can be very tough to deal with, and it's not just the weather; it's also the day, and obviously as we go into the winter, the night can be quite long, and also in the summer, the day can be very long. Sometimes it's even you can see the sun up to 10 and 11 in the evening. So it was quite distressing for me at the beginning, that my sleep cycle was completely messed up. And again, I'm going to emphasize on the housing and the accommodation issue, and try to also the paperwork is a bit struggle, along with the acronyms. And I'm going to show you a few acronyms when I came at the beginning I have struggled with. So you will find loads of people who are going to throw acronyms into the conversation, so you can gently stop them and ask them what does it mean, because you are going to have a lot of them, especially in at work. So even from the Sudanese community, they will still throw a few acronyms and abbreviations: IRB, PSCC, PPSN, a lot of hospital acronyms or abbreviations: CUH, UHL, GUH. They are all the kind of acronyms that people use. So and I find it difficult to get used to the acronyms. Even at work, they use a lot of acronyms: PT, OT, SLT, AMPs, CNMs, SHO, REG, NCHD, HCA. These are all used at work. So I'm just going to use an example of, so IRP, for example, is the Irish Residency Permit, which essentially your residency. So people do not use their residency. Sometimes they use the stamp or they use the IRP or whatsoever. For the PPSN, I think it's the public social number or public security number, if I'm not wrong. So for the work abbreviation, SHO is obviously senior house officer, CNM is the clinical nurse manager, and so on and so forth. You will find you can ask always about these. After arriving and before starting the journey, try to be up to date with the paperwork again. I'm going to emphasize on this. Try to set an appointment with the followings: occupational health. Once you arrive, try to email. It's probably HRs are on top of everything. They will try to email you saying that once you arrived, we would like you to set an appointment with the occupational health to get your occupational health clearance. There's the bank appointment. It's very important to set an appointment with the bank. We have also issues with our passport, trying to set the bank account online. Most of our Sudanese passport will not be electronically read, so we have to go through the paper way. Try to book an appointment with the bank to set your account. Obviously, if you don't have a bank account, you won't be paid. There's also, most of people use Revolut, which is a very handy. It's based just on your Irish number. So once you have an Irish number, you can set your Revolut account. Some people has some struggle with the Revolut sometimes with setting their accounts with it, and you can use it actually at the account of the payment for the salary. But I wouldn't advise for such a thing, because Revolut is very handy for the daily use. But it's not good to, for transferring a large amount of money, and security-wise as well. I have a few of my colleagues, their account have been locked because, they are transferring large amount of money. So try to use it for the daily use, but not for your salary. Also try to set an appointment with the immigration. Nowadays, some counties have moved to also an online appointment. Some counties still use the Gardaí, so you have to set up an appointment with the Gardaí, which is essentially the Irish police and the immigration. Try to set an appointment with the immigration to complete your paperwork in the form of the IRP or the residency. It's pretty handy, especially if you are applying for a visa elsewhere, going for a conference or a course or even for other things. Also, once you arrive, inform the HR personnel that you have arrived, and they are going to kind of guide you through the important steps that you need to do, especially for the hospital, from getting your ID badge, your IT logins. That's also one of the most annoying part of the Irish health system. The hospital are not connected through the IT. So whenever you are moving from hospital to hospital, you need to get used to a new um, IT system, and it can be actually pretty awful. In certain places, they are using, very backdated IT system. So that's one of the things that you will struggle with, especially in your first days. Try and see again the hospital around. Um, sorry. Try also engage with your local community. In particular, I mean the Sudanese community, and also try to engage with even the local community in the county or within the city or the town that you are living in. It's very good, especially in de-stressing in the first few days. Um, um, Also, the first days can be very tough, especially if you haven't experienced going out before in a foreign country. It can be very, very tough. So try to, call your family frequently. Make sure that connected with some form of support, especially locally. So that's why I would advise into getting into the Sudanese community or even your work colleagues if you have, been introduced to them, and try to connect and see what you can do in the first few days. Again, tips before you start the job. Try to know the hospital inside and out. Try to know the system or the system the hospital are using. Some hospitals use different system. So, for example, they use for the laboratory, they use a iLab, and for the imaging, they use NIMS or PACS, and they don't use TPRO for the letters. Or they use just a dictaphone. So try to know the system and get used to it. Also try to know the consultant that you're working with. And also if you can know the other consultant within the hospital, it's very good. Um, in different departments, the environment can be very political, and you need to know the network and how things are run around, and the relationship between different consultant, different teams. Also try to know the team that you are going to work with and the different teams around you if you can. That's also before you start. Obviously, you're not going to know all of that before you start, but I would emphasize to know your consultant at least, and maybe your team, and your base wards or home wards. In certain places, they divide the wards by specialities. So they have the surgical wards in different areas, and they have the medical wards divided by the specialities. So try to go and find your home ward and know how to get there and navigate the place around. Again, it can be very political around the place, so try to suss the relationship between people there also. It's going to help you very, very much trying to thrive your first job. Um, your first days. If you are coming in the July intake, there's usually big induction. So try to attend that induction if you can. Some people always, come very late. So for different reasons, for example, the visa, or even for their own personal reasons, they want to spend more of time with their family before they, depart. So it's reasonable, but try to attend that big induction. Some hospital also do an induction in January intake, but that's usually smaller because the amount of people are coming to the hospital, is not that big. So anyhow, try to get into the induction days. It's very handy, especially getting your logins and ID, and also knowing the rota. It's very, very good. Um, uh, Very important. Always be nice and try to introduce yourself. Um, you might, especially for us as Sudanese, we don't have the culture of introducing ourselves. We can, go and speak with some other person for an hour or so without even introducing ourselves. So you might find it silly at the beginning, but it's actually pretty handy and will make people, more comfortable dealing with you. So try to introduce yourself at the beginning of every conversation. So try do not be shy. Um, Also, I think also it's embedded in our culture that most of us are, trying to be are shy. By I don't know, is it just our culture or is it just a nature? Anyhow, try to not be shy and try to engage in conversation with others. Irish people are very chatty. They love talking about their weekends and how did they spend it. So try to engage in this conversation. It's also going to ease your life. And I think one of the important questions they ask every Friday, what you are going to do in your weekend, and every Monday, what have you done in your weekend? Always try to engage in these conversations. It's going to facilitate your, ease your life a lot, trying to get to people. Um, if you don't, if you don't, if you are not comfortable with something or you don't know something in particular, especially in your first days, always ask. Do not be afraid of asking questions, even if if they seemed stupid or if you think they are very basic, just ask them. Um, Ask whoever. You can ask interns. In your first days, no one is going to judge you. So and do not feel the imposter syndrome, where basically you're going to feel like everyone is judging me based on what I'm going to ask or based on what I'm going to say. And this is going to hold you back. So don't let the imposter hold you, the imposter feeling hold you from trying to ask any question. First days in the job can be very difficult. Also, trying to learn the bleep system or the communication system. Some hospitals have changed now into phone system. If you are using a bleep, especially in the junior level and in the SHO level, try to learn um, um, or know the bleep, how to respond to the bleep, how to bleep someone, or how to call certain people. So it's very important. There's little time-saving hacks that you are going to learn throughout the job. If you learn them early, it's going to make your life easy. So always, interns knows a lot about the system and about the time-saving hacks. So if you kind of ask them, they will tell you about what to do for certain things. How they're very helpful in these particular situations, how to save your time doing particular things. Know where to find things. So if you are doing whatsoever procedure, from the simplest withdrawing bloods or putting a line, or even to a big procedures from chest tubes, or even if you are starting at different level in theater or in cath lab, for example, try to where to find things. For those people who are starting in theaters, you probably have a scrub nurse, so and cath lab as well, so they will be handing over things to you, but try to navigate the places around, just in case if you need anything with nobody around. So try to know where is the clinical rooms, where you can find the stuff to use for any procedure, and also try to know where to find certain things. For example, portable ultrasounds or echoes. It's pretty handy to use, especially during on call. Try to carry a small note as well and write tasks, jobs, calls, bleeps that you get. Often people, overestimate themselves or their memory in particular. You can get overwhelmed by the amount of jobs and tasks that you are going to get during the day, through the phone or through the bleep or even the email, because they use the email a lot also if you're starting at higher levels. So try to write down in your small little note, the things that you need to do. And also if you learned new thing today, you can write it down about how to do this in particular. Very important tips. Be nice to everyone, but particularly the nurses and CNMs. They can make your life very difficult, to be honest. If you are very nice to them and they like you, they can make your life very easy. And sometimes they are very demanding. So, try to respond very nicely, even if their demands are too much. Try to also, by being nice, do not just step the line. Sometimes they might ask for things that are not the right things to do. So assess the situation from clinical point of view and make a decision. If you are disagreeing with someone, try to disagree with respect and try to provide a reason. And it has to be, very good explained in order for them to understand it. These people have been in the job for years, so they're using their experience or, let's say, their muscle memory. So they see certain things, they know it's done this way, so they ask for it, regardless of the clinical context. And obviously, if you are weighing things differently, you might have a different opinion or different reason for not doing it the way they usually are doing it. So if you are disagreeing, just explain why you are disagreeing and provide the reason. And take advice from nurses. You learn loads. I actually once learned from a healthcare assistant, who happened to notice a very important thing up on the patient, and it was really good learning from a healthcare assistant. So never underestimate anyone and try to listen to their concerns. They have years of practice in the field. Always do not be lazy. So what Irish people mostly hate is lazy people. So try to, especially in the first few days or weeks, try to be always volunteering to help others. And by saying so, I'm saying do not overtake too much. So try to know your limits as well, but try to be proactive and be willing to volunteer to help others in particular. So do not be lazy, and but take your time and at the same times. You don't want to make mistakes in order to make other people look like, feel like you are doing too much work. So do not be lazy, but at the same time, try to be safe. Daily thriving tips, time management, obviously. Um, at the beginning, you might find it very difficult to manage your time. I always recommend to come early, and you might take time more than others in doing your tasks. That's totally expected. So do not get overwhelmed with it, but you will improve with time. So and you will see the difference from starting at day one compared to day, for example, 6 even. And after 3 to 6 months, you will find a huge difference in the time management. You'll find yourself managing your task pretty quickly compared to when you started. So that's expected. So try to come early at the first few days, I'd say, or even weeks, in order to get your list done and try to know where you are going to, and even cast an eye on the investigations or blood investigation that you have ordered and see before the rounds starts. Always document what you have done and what you are going to do. Simplest things like procedures. In Sudan, we were not quite used to document, for example, catheter insertion and other stuff as well. So these procedures are always documented on the chart or the medical file. Communication is very important key. So try to communicate with others. If you can do something, communicate with them. Don't try to sort it the whole day. And if you are having difficulties with something. Also communicate that you are having difficulties with this particular task. There's loads of people are willing to help, and in general, the Irish people are very helpful. So try to communicate what you are doing, and if you are struggling, and if you are doing a task and they are asking for help in other area, also communicate that you are doing this task, so they don't think that you are trying to avoid the jobs, or you are hiding behind. So try to communicate, I'm doing this certain thing, and I will try to be there as soon as I can. They will understand what's going on. Try also to know how to manage your bleep. It's very important to the management of the bleep. And a few tips for on-call. Try to shadow before you start. It's very important. Most of hospitals, they won't throw you into, the hell straight. So they will give you plenty of time before you start your on-call. So try to shadow a few calls before you start, especially if you're starting as a reg. You need to see how things are done and how things are expected to be done, actually. And so I'm quite sure most of people who are starting have the knowledge, but they don't know how, people are expecting you to deal with certain things. So the expectation here is a bit different, and the way of dealing with things are a bit different as well. If you are not confident yet of starting on call, always email HR saying, I'd like to get, a few more weeks in order to get myself comfortable with the system and be more confident in myself. So do not be shy of asking, your calls to be delayed. They will understand this. Always prioritize unwell patients. So at the start, that's obvious. But by saying so, you can face certain, a situation where you have to choose and to go see, a really sick patient compared to another patient who are, sick as well. So you need to prioritize which patient I need to see first, and maybe delegate the task of seeing, the other sick patient to someone else. Do not delay asking for help. Always ask for help from seniors. So if you're on call as a reg down in ED, you can ask your colleagues in the A&E. They can be very helpful as well. You can always ask anesthetics for help. You can always ask, other people. And I'm quite sure also there's loads of, Sudanese support as well. You can, personally, some people has offered me to, to go through the patient that I'm seeing, in order to, make me more comfortable dealing with the patient, or even going through the management plan. So they are always going to offer help. Always write the jobs and tasks, as I said. Always make time for yourself. Make sure that you are eating. Uh, Try to eat snacks and drink plenty of water. You will be surprised that you are not drinking enough water in Ireland. It's just the weather. So when you start, try to make sure that you're drinking enough water and fluids, and also eating snacks, because 12 hours shift can go without you noticing that you haven't ate or drank anything during the call. Always take care of yourself, because nobody's going to take care of you, except you. So make sure that you're taking very good care of yourself after you start, because you can forget easily, to take care of yourself, or given how busy the job is. Self-care and well-being. Eat properly, make sure that you are hydrated, sleep when you can, and try to make good amount of sleep for yourself. This all very important tips. You might see them silly here, but when you start the busy job, you can see how busy it is, and you can easily slip into the burnout So you have to be careful with this. Always try to find hobbies and try to exercise. The burnout is actually quite real. I wouldn't believe it until, I have started here and I have seen people who are actually burned out, and you can see them that actually in their face, in their way of communication, being overwhelmed. They can be very, snappy, and they can, even lash out at you, even if you haven't done anything, but it's just the overwhelm. So burnout is actually real. Also, make sure that you are planning for your career and your training. So always try to keep your e-portfolio updated. There is an e-portfolio in the NAER, so you can fill that portfolio. People who are in training, RCSI and RCPI has their own layout for the portfolio. I think they use Kaizen for the RCPI. So always try to keep your portfolio updated. Keep track of the application dates for the PST and the HST and the core surgical training, and also the GP training. They have different start dates, and they can change from year to year. For example, this year, the PST application has started early in September compared to last year, where it has started at October, I think. So keep track of the application dates and make sure that you have the supporting documents for the application. So plan for your application in advance. Try to get involved. Try to involve yourself in research and audits, and also projects. So it can elevate your CV and applications for certain training posts. So always try to involve yourself in research, and ask your peers, seniors about career path. So and this is very good also through the community, the Sudanese community, and as well the SDUI. So you can ask, if you're targeting certain specialty, you can go directly and talk to the people in the specialty about how to plan your career path. Common pitfalls to avoid. I have seen loads of people not asking for help. So and I think it's also part of us that we try to solve problem without asking for help. You have um, to know that you are not going to solve every problem on your own. So you have to ask for help at some point. So it's better to ask early rather than late. And also one of the most common pitfalls, poor documentation, especially at the start. Um, you you actually you might not realize the amount of the legal stuff going on, because you are at the junior level. But try to document that. I have seen people on the coronary court for loads of stuff, but the only thing that saved them was their documentation. So also ignoring emails. Try to check your email regularly, especially your HSE emails. So try to be on top of your jobs and tasks. Overcommitting to projects and research. Some people take the advice of involving in projects, and they take 3 or 4 projects at the same times, and not knowing their limitations. So try to be realistic about committing yourself to the projects. So to conclude this, it's very steep learning curve, but you can grow fast. Always, patient safety first. It's one of the pillars, and non-malfeasance. So try to be beneficent, but also non-malfeasance. So and look after yourself. It's not just about survival, it's about thriving. So make sure that you are thriving, not just surviving. Um, and thank you very much.
Musab, that was a great presentation. If I may just take just a second, I might. My sincere condolences for your grandmother. We're not aware of this. ربنا يرحمه ويغفر له إن شاء الله. البقية في حياتك وحياتكم إن شاء الله وربنا يصبركم بإذن الله. Um, my sincere condolences for this. Thank you very much for giving us this very lovely talk, despite the difficult circumstances that you're going through. Okay. I think Lena is also still there with us, or unless she went to sleep.
No, I'm still here.
Still here. Okay. Okay. It's great, to be honest. Lena, I think are you an Irish graduate?
I am, yeah. So I was born and kind of lived here my whole life, studied in Cork. Yeah, graduated from UCC last year.
Oh, UCC. Very enough. Beautiful campus.
Yeah.
So Cork was actually my first job in the country. So that was it was, to be honest, both of you gave amazing different perspectives. Like Lena, you took us through the perspective, not too much, but obviously in a way that if you're blended within the system, but at the same time touching on what you should know from a medical perspective, but at the same time you need to go over your TSS, you need to get your courses, don't forget everything, the financial burden and everything, which is excellent, to be very frank with you. A lot of us tend to forget about these things. The applications that you threw on the picture of the application is actually great. They're a great help, and they don't just help; they just help you when you're stuck, when you're forgetting those little things. The only application I think that I didn't find there was the BNF, and the only reason I would say BNF is it's actually free if you go to UK and you connect to any Wi-Fi and download it. But to be honest, eMed and the NCHD guide, they were lifesavers, and they've been there forever, basically. Do you know?
Yeah.
Being organized, you can't emphasize on how organized you have to be, honestly. I cannot emphasize, everyone has their own way of being organized, I don't know. For me, it was like even having a Google document checklist and then just check as I go. That made my life a lot easier, Your teamwork and communication skills, thank you very much for touching on that. Unfortunately, as Sudanese doctors and as Sudanese descendants, if you may, we always tend to have this thing that I can do it on my own. I can do it. I don't need anyone's help. It's fine. It's a patient. I can take care of a patient. Yes, you are capable of taking care of a patient. No one's doubting your abilities as a doctor, as a human being, if you're nice, if you're not. But at the same time, if you communicate with other people, you delegate jobs, whether you're senior, whether you're a junior, it doesn't matter. So that's amazing. Asking for help is also another bit. I don't know if do you have any tips for juniors when you started as an intern? Because to be honest, starting as an intern here, when you graduate, you already have tips and tricks underneath your shoulder that you always tend to wear, like the little square boxes, that you put, and you put the ticks next to it whenever it's done. Do you have any major tips for the doctors who are just starting and they're finding it very difficult to catch up for your first call, for instance, let's say?
Yeah, so it kind of touches back on what you were talking about, but it's all about delegating and kind of triaging. The bleep is constantly going off, kind of no matter where you're working. Being on call is busy, especially night shifts. You're going to get constant calls. And then on the other side of things, you're going to get people becoming a little bit impatient. If you're kind of somewhere else in the hospital, one ward is ringing you for a cannula, maybe someone's ringing you for reviewing a sick patient. It's just important to kind of communicate. I think Musab touched on this. Just communicate that you're currently dealing with maybe someone sicker. They need you at this very moment. If it's cannulas, if it's something for antibiotics that a patient needs in another 5 or 6 hours, that's not urgent. It's important to be firm, not rude on a phone, but firm, and just kind of always explain why you're not doing something straight away. So triage, make a list, and tick it off as you're going through. It's just it's nice to see yourself go through your to-do list, and you won't lose track of things. Don't try and remember things and leave it all in your head, especially in the middle of the night. You're kind of bound to forget things. write everything down, have it laid out nicely for you, and make it as easy as possible for yourself to get through the shift as much as you can. So just kind of try and introduce those little things early on, and then they'll just become habit as the year goes on. So it's kind of more of just getting used to it, finding out what works for you, and then just stick to it.
Okay. You kind of summed it up, but there was a little question that if you were to pick one piece of valuable advice, something that you just stick by it, full stop. Well, for someone who's starting their first HEC job, whether it's on call or not on call, what would you pick? What would that be?
I suppose for someone starting out, it's just knowing when to escalate, knowing when to ask for it. But I think I kind of found that to be the most difficult thing in the beginning. I was kind of like, what's expected of me at this stage? What should I know how to do on my own? And what should I kind of what am I allowed to ask for help about? And I think if you're the kind of answer is really easy if you're ever unsure or if it's something that might potentially be detrimental to a patient. Don't try and come up with the answer yourself. Ask for help, escalate, patient safety at the forefront. There's a lot of trying to look smart or trying to be impressive amongst peers or like trying to impress senior members of the team. None of that is really important if you end up harming a patient in the meantime. So know when to ask for help. Don't try and solve things yourself, especially early on. No one expects you to know everything. It's a training process for a reason. You'll get better as the years go on. You're not expected to be an expert year one. So kind of just ask for help, get used to things before you start making big decisions yourself.
Fair enough. To be honest, I think asking for help and escalating, I think is a big challenge for everyone. Like everyone's here to help, which brings me actually to Musab's point where he was talking about making friends with the nurses and everything. To be honest, when you're first starting coming from a different system, like I worked in different countries. When I landed here, to be honest, I was told that just nurses are going to be your friends, and to be honest, they are. If you just approach them, it's like, listen, I'm sorry, it's my first call, it's my first couple of days in the country. They will help you. All you need to do is ask. If you ask for help, which brings me to the main point, is the Irish are very friendly. Like it's in their nature. They're very friendly. Full stop. Okay. I cannot emphasize on how friendly they are. You can ask anyone on the street for directions. They might be able to actually take you there rather than just pointing you out, especially for the two of you guys are in Cork. Like honestly, down south, like everyone's friendly. Everyone's happy to help. Musab, you actually chose the worst video to show the Irish accent. Like you chose the west of the west of the west, if I may. Like it doesn't get worse than this. Like even people in Cork City will have trouble understanding him, Like the reporter needed a translator. Yes, for a very, very small country, they have so many accents. And someone from one town will have trouble understanding the lingo of another town, which is you're absolutely right. I had trouble in the Mercy University Hospital in ED. Like even an Irish nurse couldn't understand my patient, which is, understandable, you know. Tell me this, if you had one piece of advice for everyone, for someone who, from your side, as someone who came from abroad, as opposed to Lena, who's basically a local, what would you say? One piece of advice.
I think my only piece of advice is try to be safe regardless. So this would conclude everything. If, as Lena said, if you are not sure, ask. I actually, this also includes if you think the job role that you have started in doesn't fit you, just go and speak to your consultant and, tell your line manager basically and tell him that I don't think this job is fitting me. If you came as this is particularly I'm saying is if you came as a reg and then you thought it's too much, you can go and speak to him. He might have some solution by trying to give you more time, maybe, a short period of stepping as SHO and then escalating you back to your reg post, or even he can, even demote you completely. But, always try to be safe. This is part of being safe, knowing when to say that you can do this as a task or even the whole job. So it's very important to be safe. I think this is my only piece of advice.
Okay. All right. Fair enough. I have a question for you as well. Looks like Raya was doing her homework. She prepared all these questions for each and every individual. So she was asking if something went wrong within the team's dynamics. So let's say an unfortunate event had happened or occurred. Let's say giving the wrong medication for someone who's allergic to penicillin or something like this. What's the procedure for following something like that? Would you just maybe unfold on that for our junior doctors who may not have experienced such a thing?
Yeah, I think unfolding on that is a big mistake anyhow. So it's you kind of you need to report that. So there's error or incident reporting. So you need to report that error in particular. That's first of all, and then you need to go and have an open disclosure with the patient about what happened. The HSE has a whole setup, and they have modules for open disclosure. They have the first module and second module for open disclosure. They can be read online, and then you can go for a third workshop for dealing with a big open disclosure. This is usually at the consultant level because this this usually happens in big events, unfortunate event like a death of a patient that's unexpected. So you go apologize to patient basically, that an error has happened. You don't need to shame or blame. You just say that this error has happened. If it's caused damage, you need to acknowledge the damage that has been caused and also tell the patient that you are going to try to improve things by trying to make some changes or and escalating this to a different level. Always try to involve your consultant in such areas as well. So even if you're a reg, just tell the consultant that this has happened. So because when you're coming on the round, the patient can be very snappy with the consultant saying that, oh, your team has made this certain error. So you need to tell him in advance, so he's expected that the patient can be, um, angry or I think most of the consultant would ask you what the patient reaction is. He angry? Is he mad? If you went and spoke to them, so they ask you about their expectation going to the patient. So speaking to the patient, speaking to their family if they are old enough and or they don't have the capacity or whatsoever. So you need to speak to the family and involve them, and always apologize. Make it very clearly to apologize, and also try to tell them that you are going to try to improve things, escalate, document all of what happened, and also incident report that because especially if harm has been done to the patient.
Fair enough. Okay, yeah, that's great. That's great. That's actually very great. As you said, open disclosure, that's a topic that we've touched on on a previous session. But yeah, that's very important. I think Aisha has a quick question. She has advice for someone who has a career gap due to work conflict and it's trying to get their first job in Ireland. We did touch on that previously, but to be very frank with you, Aisha, the best thing to do is not to lie. If you have a career gap due to war, due to something, everyone understands. People go through years of not working and then they end up getting a job. It has nothing to do with as long as you have an explanation for that gap. I had time for my family. I was sick. It was war, relocation. People are understanding, So definitely just be honest. There's no need for you to, try to avoid it. It's not a problem. Okay, Lena, I might just come back to you if you don't mind. I mean, you were an intern. You now are CSDSHO, is that correct? Can you tell us, this is a problem that all of us actually some of us will probably run into when we first start the job. How can you avoid when it's your first job and you're the new person, it's always your fault. Everyone knows that. It's the unsaid rule. So it's your fault if something goes wrong. You're the new guy around the block. Everyone's been here. The nurses have been here for a million years. The reg was a reg for in the country. You're the new person in the block in the country. All right. I don't want to use big words as bullying, but if someone tries to, let's say, pick on you a little bit, just because you're the new person, as in like, yeah, this is kind of your fault. You need to realize that. apart from knowing what your duties are, can you tell us what could you, maybe a tip or two for how to avoid these things, coming from an intern to an SHO and progressing in your career very smoothly?
Yeah, so medicine, obviously hierarchy is a big thing. Unfortunately, I do think you just have to kind of take the brunt. It's probably not, I don't know if that's great advice, but you kind of expect to just take the brunt of it for, especially as an intern, and slowly working up. Luckily, I've been kind of fortunate enough to be in teams where I've had really good dynamics with the different members of the team, even throughout intern year and now as an SHO. So thankfully, I haven't had any of those experiences personally myself. But if something's happening and it's really starting to bother you and it's kind of affecting your mood and it's making you not look forward to coming into work and it's really starting to bother you, I do think you need to flag that with someone else on your team. You shouldn't be expected to deal with that on your own. Most teams have a senior reg or like a senior member of the team. I think that's a great person to reach out to first before kind of it's a bit easier than going to a consultant or something like that. So go to the senior member of the team, mention this to them. You don't necessarily have to be naming names or snitching, but just mention that you're kind of finding it difficult in the department, and then let them know kind of what's been going on. There's usually someone there to help you. You're not really expected to kind of deal with all of that on your own, and just kind of something to be aware of. Just as the years go on, as you become more senior, you'll kind of get less and less of it. But hierarchy is kind of one of the negative sides when it comes to working within a team, but you just kind of have to slowly kind of try and build a thick skin. Don't kind of let things get to you too much. And I think that just comes with practice. You're not really expected to be like that from the get-go, but as time goes on.
Yeah, pretty much. Just as long as you, I suppose as long as you know what your role is, what your job is, you're meant to do this. Is this your job or is this not your job? If it is your job, then take it. If it's not your job, then if you do it, you're helping someone else. You know, you may
Yeah.
call it your favor.
And if you're finding that like maybe you're being asked to do stuff that's outside of your scope, outside of your level, say it to them straight away. Don't take on something that you think isn't kind of relevant to your stage, something that could be dangerous to a patient. If you're kind of being asked to do something, flag it early. You shouldn't really have that level of responsibility so early on in your career. So mention it straight away, kind of flag that with the team as well.
Absolutely, absolutely. No, it's very important to know what your role is, and we all do things that are not exactly part of our job description, but as long as it serves the patient. At the end of the day, we are here for a purpose. We're all doctors serving patients at the end of the day. All right, if I just one last question for Musab, if you may, would you advise someone who hasn't worked in Europe or within the HSE or NHS to start as a reg in the country? Would you advise them?
So I think to answer this question is it has been done before, so you can do it yourself. It's a big transition though. It's not an easy transition. So if I'm saying it's an easy transition, I'll be lying. But it can be done. But you need to know that you are going to struggle a lot at the beginning. And you need to be up to it in order to be in the you can survive the job, but you can be, I'm sorry to say it, you can be shitty at your job as well. So it can go the other way. You can still, manage to survive the job, keep it till the end, but you might not progress in your career very well. So I think it can be done. You need to know it's going to be a big transition, huge responsibility, and you are going to face challenges that you haven't faced before.
Would it be safe to say that you'll find it difficult to thrive? You will survive, but you'll find it difficult to thrive, as you emphasized previously.
Yeah, it's difficult to thrive, but it can be done again. I'm sorry, I'm saying so. Yeah, it has been done, so it can be done. So
Um,
if someone has done it, you can do it. That's this,
Fair enough. Brilliant. Okay. Lena, thank you very much for a lovely presentation. Musab, my sincere condolences one more time for you and your lovely family. Thank you very much for giving us your time. It's very precious. I completely understand that. Um, Thank you both for an amazing presentation. Two different perspectives. We were definitely not expecting that. Once again, thank you everyone for attending our event for today, as part of the marathon, and we'll see you next time. Thank you very much. Have a good evening.